Welcome, everyone, to our deep dive into phobias. We've got, a stack of research papers and expert opinions all about phobias you guys sent us.
It is a lot of information.
And, our goal is to, sort through it all and really break down what matters about these fears.
Exactly.
Like, how are they classified? How do we even categorize them?
Yeah.
How common are they? Like, how many people actually have these things?
Hmm.
And, what kind of impact do they have on people's lives?
Right.
And maybe most importantly, are there treatments that work? Like, what can we actually do about this?
Absolutely.
I've got to say, I was already surprised in just glancing through this stuff,
Oh, yeah.
finding out that there's actually a specific phobia for a fear of choking.
Wow.
It's called sphincteric phobia.
That's pretty specific.
It is very specific.
Yeah.
But, before we get into all the different types and subtypes and, all the weird ones,
Hmm.
let's take a step back and really define what exactly is a phobia.
Right. Well, that's really important because, a phobia, it's not just like your everyday fear, like we all experience fear.
Right.
It's a natural response that keeps us safe.
It's a good thing.
Right. Exactly. It's important. We need to have fear.
Yeah.
But a phobia, it's an intense and irrational fear of something that's really way out of proportion to the actual danger it poses.
Right.
And it significantly disrupts your daily life.
So it's the difference between, being a little nervous about giving a presentation
Mm-hmm.
versus being so terrified that you literally can't leave the house.
Right, exactly. It's about that level of disruption to your life. And, it's interesting. There's this great quote from Erasmus back in the 15th century when he was fleeing the plague.
Oh, wow.
And he said, really, I consider total absence of fear in situations such as mine to be the mark not of a valiant fellow, but of a dolt.
Okay.
Which, it just shows that a little fear is sensible,
Right.
but when it takes over, it becomes a real problem.
You need a little bit.
You need a little bit. Yeah.
So how do the experts, how do they even start to categorize all these different fears? Like, where do you even begin?
Well, to make sense of the world of phobias, we use these classification systems.
Okay.
Like the ICD-10 and the DSM.
Okay.
And they group phobias into these main categories.
Okay.
So we've got agoraphobia,
Uh-huh.
social phobia, and specific phobia.
Okay, so those are like the three big buckets.
Exactly. And then under each of those, we have these subtypes that define the fear even further.
Okay, so I'm guessing the specific phobias, that's where we get into fear of choking and things like that.
Exactly. Yeah, specific phobias are probably what most people think of when they hear the word phobia.
Right, right.
So, fears of specific objects or situations,
Right.
like fear of spiders, heights, flying, or even, the fear of choking that we were talking about.
Right. We've got a whole section here on agoraphobia.
Yes.
Now, isn't that just the fear of open spaces?
It's a little more nuanced than that.
Okay.
It is often associated with the fear of open spaces.
Right.
But it's more accurately described as the fear of being trapped
Oh, okay.
or unable to escape a situation.
I see.
So, yes, that can include open spaces,
Okay.
but it can also include things like crowds
Mm-hmm.
or public transportation or even just being outside of one's home alone.
Yeah, there's this case study in one of these articles where an 18-year-old woman actually became housebound for 7 years
Wow.
because of agoraphobia.
Yeah.
And that just, that really hits home how debilitating this can actually be.
It absolutely does. And it's important to note there's actually a bit of debate about the relationship between agoraphobia and panic disorder.
Okay.
Because some researchers, they believe that panic attacks always precede agoraphobia,
Uh-huh.
while others argue that it can actually develop independently.
So it's not just about fearing the panic attack itself, but it's the fear of being trapped somewhere,
Mhm.
that if a panic attack did happen,
Right.
you couldn't get out.
Exactly. And that fear of having a panic attack in a place where escape might be difficult, that can lead to these avoidance behaviors that become really restrictive.
Wow, okay. So we also have a ton of information here on social phobia.
Mhm.
I think most people just think of that as being shy, right?
Yeah, a lot of people kind of equate it with shyness,
Right.
but it's actually a lot more complex than that.
Okay.
Social phobia. It's characterized by an intense fear of social situations where you might be judged
Okay.
or scrutinized by others.
Right.
This can include things like public speaking,
Uh-huh.
eating in front of others, or even just casual conversations.
I thought this was interesting. There was a story in one of these articles
Mm-hmm.
about a man who was describing, avoiding social situations because he was terrified of sweating.
Oh, wow. Oh,
But he said that he had a normal sex life with his wife,
okay.
and it just seemed kind of contradictory.
Yeah.
But I guess, social phobia can be very specific.
It absolutely can.
Yeah.
And that's a great example of how social phobia can be very specific to certain situations.
Yes. Yeah.
So this man, he might feel completely comfortable and secure
Yeah.
in that intimate relationship with his wife where, the fear of judgment is less prominent.
Right. He's not worried about what people are thinking.
Exactly. Yeah.
Interesting. But then, on the other hand, we have a case study here about a 20-year-old woman with social phobia who is housebound and experiences panic attacks. So how do you tell the difference then between social phobia and something like agoraphobia?
Right. Because in both cases, the person is essentially, avoiding going out.
Right.
So that's where careful diagnosis is so important.
Okay.
Because while both social phobia and agoraphobia can lead to avoiding going out,
Right.
the underlying fears are very different.
Okay.
So in social phobia, it's that fear of negative social judgment.
Mm-hmm.
And in agoraphobia, it's that fear of being trapped or unable to escape.
Oh, I see. Okay.
And of course, you always have to consider other factors too, like depression,
Right.
which can also contribute to that social isolation.
Makes sense. So, okay. So we've got agoraphobia. We've got social phobia.
Mm-hmm.
Now we get to the fun part.
Okay.
The wide world of specific phobias.
Yes.
We're talking fear of snakes, spiders, heights, and closed spaces, and as we said earlier, even fear of choking.
And don't forget about phobias related to illness,
Oh, right.
like the fear of epilepsy or getting diseases like SARS.
Yeah.
We actually have a case study here about a woman who wouldn't leave her house alone because she was so afraid of having a seizure.
Wow.
Really shows how specific phobias, even if they seem irrational, can have a huge impact on someone's life.
It's incredible. Speaking of fear, though, there's this other thing mentioned in here
Okay.
called aversions.
Yes.
So how are those different from phobias?
That's an important distinction.
Okay.
Because aversions are more about intense dislike or disgust rather than fear.
Okay.
So you can think of it this way. A phobia is a fear-based response, whereas an aversion is a discomfort-based response.
Okay.
So someone might have an aversion to certain textures or tastes or sounds.
Right.
And that causes them to avoid those things.
Right.
But it wouldn't necessarily trigger the same kind of intense fear and anxiety as a phobia would.
So like someone who hates the sound of nails on a chalkboard.
Exactly. Yeah, that would be an aversion.
Okay.
It's a strong dislike, but it doesn't cause that level of debilitating fear and avoidance that you see with a phobia.
I see. Okay. This deep dive also goes into, the whole nature versus nurture debate with phobias.
Yes.
So is it genetic or is it environmental? Like what causes these fears to develop?
Well, the research actually suggests that it's a little bit of both.
Okay.
So twin studies have shown that there is a genetic predisposition
Okay.
to developing phobias, but it's not a guaranteed outcome.
Okay.
Environmental factors, they play a huge role
Okay.
in how those genetic predispositions actually manifest.
Like what kind of environmental factors?
Well, things like traumatic experiences
Okay.
or learned responses from, maybe your parents
Right.
or even cultural influences.
Interesting. So even if you have that genetic predisposition, it doesn't mean you're doomed.
Exactly. It depends on your life experiences and how you learn to cope with fear.
So it's complex.
It is complex, yeah.
All right. So we've talked about how they're categorized, where they might come from. Now let's talk about how common are these things? Like how many people are actually dealing with phobias?
Yeah. Well, that's where these large-scale surveys come in, like the ECA and the NCS.
Okay.
And what they tell us is that phobias are surprisingly prevalent.
Okay.
Now, I won't bore you with specific numbers here,
Okay.
but the key takeaway is that phobias are a lot more common than most people think.
It's like a hidden epidemic.
Yeah.
People just don't talk about it.
Right.
Maybe because they're embarrassed or they don't know that help is available.
Yeah, that's a big part of it.
But I guess the real question is, how much do these phobias actually impact people's lives? I mean, is it just like feeling scared or is there more to it?
Well, that's what we'll explore next, but the impact of phobias goes way beyond just feeling scared.
Okay.
It can actually affect your job, your relationships, your overall quality of life.
Wow.
And the research actually shows that untreated phobias, they tend to become chronic, meaning they can last for years or even decades.
Oh, wow. That's scary. I'm even more interested now to learn about the treatments that are available.
Yeah, well, we'll talk about that next time.
Okay.
We'll delve into what actually works to help people overcome these fears.
Sounds good.
All right.
Let's take a break.
Okay. It really can. And, when we talk about impact, one of the studies you sent
Yeah.
really highlighted the social and economic costs of phobias.
Yeah.
And it's pretty startling.
Yeah. What stood out to you from that research?
Well, one thing that really struck me was the finding that agoraphobia can actually be more disabling than panic disorder alone.
Oh, wow.
We tend to think of the panic attacks
Right.
as being the most debilitating part.
Right, of course.
But that fear of being trapped or unable to escape,
Yeah, right.
that can be even more restrictive.
So it's not just the fear of having a panic attack, but it's the fear of being trapped in a situation where you couldn't get out.
Exactly. And it can lead to people avoiding a whole range of situations,
Right.
even ones that might seem relatively safe to others.
I see.
It's like their world shrinks as the phobia takes hold.
It makes you wonder if there's something about modern society that contributes to this,
Yeah.
Are we becoming more fearful as a culture?
That's a fascinating question.
Yeah.
And while some phobias seem kind of timeless.
Right, like fear of snakes.
Exactly. Fear of snakes,
Yep.
spiders.
So those have been around forever.
Right, exactly. But others seem to reflect our current anxieties.
Oh, that's interesting.
So you think about the rise of phobias related to diseases like SARS,
Uh-huh.
or even fears of technology.
Oh, right.
They highlight how our phobias can mirror the threats and uncertainties that we face in our lives.
It's like our fears evolve with our understanding of the world.
Right.
But if phobias are often learned responses to these perceived threats, does that mean we can unlearn them too?
Well, that's the core principle behind exposure therapy.
Okay.
So by repeatedly confronting your fears in a safe and controlled environment, you can essentially rewire your brain to respond differently.
So you're retraining your brain.
Exactly.
But for someone who's been living with a phobia for years, that must sound terrifying in itself.
Oh, yeah. It can be very daunting.
So how do you even begin to convince someone to do that, to face their fear?
Well, it's a gradual process.
Okay.
Exposure therapy, it's not about throwing someone into the deep end of their fear right away.
Okay.
It's about taking small, manageable steps
Okay.
and gradually increasing the level of exposure
Okay.
as the person gets more comfortable.
So like dipping your toes in the water before you jump in the pool.
Exactly. Yeah. A good analogy.
And there are different techniques depending on the type of phobia.
Yeah. There are a variety of techniques that can be used.
So what are some of the different techniques?
Well, one common one is in vivo exposure.
Okay.
And that's where the person actually confronts the feared situation in real life.
Okay.
So, for example, if someone has a fear of spiders,
Yeah.
they might start by looking at pictures of spiders,
Okay.
then maybe watching videos,
Mm-hmm.
and eventually work their way up to actually being in the same room as a spider.
That sounds incredibly challenging.
And it can be. Yeah, it's a challenging process, but
But also empowering if it works.
it can be very empowering.
Yeah. Are there situations where in vivo exposure isn't possible or appropriate?
Absolutely there are.
Okay.
So in those cases, we might use something called imaginal exposure.
Okay.
And that's where the person vividly imagines the feared situation.
Okay.
So this can be helpful for phobias where it's difficult or impossible to recreate the situation in real life.
So like a fear of flying.
Exactly. Fear of flying or public speaking. Those are good examples.
So if I'm afraid of public speaking, I might imagine myself giving a presentation
Yeah.
in front of a big audience.
Right. And by repeatedly imagining that situation,
Uh-huh.
you can gradually desensitize yourself
Okay.
to the fear and anxiety it triggers.
Interesting. So it's like creating a virtual reality experience in your mind.
You could think of it that way.
Yeah.
Yeah. And the key is to make that visualization as vivid and realistic as possible,
I see.
engaging all of your senses.
Okay. Are there other techniques as well?
Yes, there are.
Yeah.
So, for example, for some phobias like blood injection injury phobia,
Okay.
there's a technique called applied tension,
Okay.
and that involves tensing your muscles to prevent fainting.
Oh, wow.
So this is particularly helpful for people who experience a drop in blood pressure
Oh, right.
when they're confronted with their fear.
Okay, I see. So does this stuff actually work, though?
Yeah, that's the important question, right?
Yeah.
Does exposure therapy actually work? And, well, luckily, there's a wealth of research that shows that it is highly effective. For a wide range of phobias,
Good.
studies have shown that people who undergo exposure therapy, they experience a significant reduction in their fear and avoidance behaviors.
That's reassuring.
It is. But I imagine it's not always easy to access these types of therapies.
Right. Like how readily available is this?
Yeah. Access to mental health care, including, specialized therapies like exposure therapy,
Yeah.
it can be a challenge.
Okay.
And there are a lot of factors that contribute to that.
Like what kind of factors?
Well, things like cost, for example.
Right.
The availability of therapists in your area, and even just awareness of the treatment options.
Right. People might not even know this is out there.
Exactly. And all of those things can be barriers to getting help.
Yeah, it highlights the importance of advocating for increased access to mental health services
Absolutely.
and reducing the stigma around seeking help for these conditions.
I couldn't agree more.
We've focused a lot on the psychological approaches to treating phobias, but what about medication? Can medication play a role in helping people manage these fears?
Absolutely. Medications can be really helpful in managing the physiological symptoms of anxiety.
Okay.
So things like rapid heart rate, shortness of breath, dizziness.
Right, so it's calming your body down.
Exactly. It's helping to calm that fight or flight response
Right.
when someone is confronted with their fear.
And that can be helpful in the early stages of treatment, maybe.
It can, yeah, especially when the fear might be too intense
Right.
for someone to engage in exposure therapy effectively.
So it creates like a window of opportunity
It can, yeah.
to start working on the underlying stuff.
Right, because it's important to remember that medication alone doesn't address the root cause of the phobia.
Right, it's not a cure.
Exactly, it's not a cure, and it's often most effective when it's used in conjunction with psychotherapy.
Okay, so therapy plus medication.
Exactly.
What are some of the medications that are commonly used for phobias?
Well, one class of medications that's often used is selective serotonin reuptake inhibitors, or SSRIs.
Oh, okay. SSRIs, I've heard of those.
Yeah, and they work by increasing the levels of serotonin in the brain, which can have a calming effect on anxiety.
I've heard of those being used for depression. Do they work the same way for anxiety?
There's some overlap in how they work for both conditions.
Okay.
So serotonin, it plays a role in regulating mood, sleep, and anxiety.
Right.
So increasing serotonin levels can have a positive impact on all three.
Makes sense. Are there other medications as well?
Yeah, another class of medications that's sometimes used is benzodiazepines.
Okay.
And these work more quickly than SSRIs,
Okay.
but they're typically only used for short-term relief of anxiety symptoms.
Why? Short term.
Well, there are some potential downsides to long-term use of benzodiazepines.
Okay.
So, for example, they can be habit-forming,
Oh.
and people can develop tolerance to them, meaning they need higher doses over time to achieve the same effect.
I see.
And they can also have some side effects,
Okay.
like drowsiness and impaired coordination.
So it's important to talk to your doctor. It's crucial about the risks and benefits.
Absolutely. The decision to use medication and which medication to use is a very individualized one.
Right.
It depends on a lot of factors,
Okay.
like the severity of the phobia, the individual's medical history, and their preferences.
We've talked a lot about the different treatments available.
We have.
But there's this other aspect of this that I find really interesting, and that's the role of patient filtering in seeking treatment.
That's a crucial point. And even though effective treatments are available, many people with phobias, they never seek help.
Well, why is that?
Oh, there are a lot of reasons for that.
Okay.
But one of the biggest is this thing called patient filtering.
What is patient filtering?
Well, it's basically the process by which people decide whether or not their symptoms are serious enough to warrant seeking professional help.
Okay.
And unfortunately, with phobias, many people dismiss their fears as being silly or irrational,
Right.
and they don't realize how much their lives are being impacted.
So they're filtering themselves out of the treatment system.
Exactly. They might think, it's just a fear of spiders. It's not a big deal.
Right.
Even though their fear might be preventing them from going outside or socializing or even just functioning normally.
It's like they're minimizing their own suffering.
Exactly. And the tragic thing is that the longer someone waits to seek help,
Yeah.
the more entrenched the phobia becomes.
Oh, wow.
And the harder it can be to treat.
Oh, so it's really important to get help early on.
Early intervention is key.
Okay.
The sooner someone seeks help, the better the chances of successful treatment.
What can be done to encourage people to seek help sooner?
Well, I think a big part of it is raising awareness
Okay.
about phobias and the fact that they are treatable.
Mm.
We need to reduce the stigma associated with mental health conditions
Right.
and create a culture where people feel comfortable talking about their struggles and seeking help.
It's about normalizing these conversations around mental health.
Exactly. And it's about making it clear that it's okay to not be okay.
Yeah. We also need to make sure people have access to accurate information
Absolutely.
about phobias and the treatments that are available.
Yeah, because too often people rely on outdated or inaccurate information from the internet,
Right.
which can perpetuate myths and misconceptions.
Right. It's about empowering people with knowledge
Exactly.
so they can make informed decisions about their health.
I agree.
We've covered a lot of ground in this deep dive.
We have.
From the different types of phobias to the treatments available.
Mm-hmm.
But before we wrap up, I want to circle back to something we talked about earlier.
Okay.
And that's the impact of phobias on society as a whole.
Right, because phobias don't just impact individuals.
Of course.
They have these ripple effects
Okay.
on families, workplaces, and even the economy.
Absolutely. I mean, think about all the lost productivity.
Yeah.
Due to people missing work because of their phobias.
Right.
Or the healthcare costs associated with treating these conditions.
Exactly. And that's not even taking into account the emotional toll on families and loved ones.
Yeah, so it really underscores the need for a public health approach to addressing phobias.
Absolutely.
We need to invest in research prevention and treatment programs and make sure these resources are accessible to everyone.
I agree.
It's about shifting our mindset from seeing this as a personal problem to a public health issue.
Exactly.
That deserves attention and investment.
I think it's about recognizing that mental health is just as important as physical health, and that investing in mental health services is investing in the well-being of our society.
I like that we've talked about, various treatments, psychological, pharmacological. But there's this other area I find really interesting.
Okay.
And that's the role of research in advancing our understanding and treatment of these conditions.
Research is absolutely essential.
Yeah.
It drives innovation in treatment approaches. It helps us to better understand the underlying causes of phobias. And it informs public health policies.
Right, but there are some important gaps in the research that need to be addressed.
Absolutely.
For example, we need more studies on the long-term effectiveness of different treatments.
Yes, especially in real-world settings.
Right, and we need more research on how to tailor treatments to diverse populations.
Right, taking into account cultural factors, socioeconomic status, individual preferences.
Yeah, it's not one size fits all.
Exactly.
And as we discussed earlier, we need more research on the interplay between psychotherapy and pharmacotherapy.
Right, finding the optimal combinations and timings for these approaches.
It's about taking a personalized and holistic approach to treatment.
It is. It's about moving beyond that one-size-fits-all model.
Right.
And recognizing that what works for one person might not work for another.
Right.
We need to embrace the complexity of phobias and develop treatment plans that are as unique as the individuals experiencing them.
It's about empowering individuals to be active participants in their own treatment.
Absolutely.
Working collaboratively with clinicians to find the path that works for them.
It's been a fascinating journey exploring the world of phobias.
It has.
And what we've discovered is that these conditions are far more common and impactful than many people realize.
Yeah, I agree.
But with the right knowledge, support, and treatment, individuals can overcome their fears and live really fulfilling lives.
And as a society, we have a responsibility to invest in research prevention and treatment programs.
Yes.
And to create a culture that embraces mental health and supports those who are struggling.
Couldn't agree more.
It's about fostering resilience, compassion, and hope in the face of fear.
Absolutely well said.
This has been a really eye-opening deep dive,
Yes.
into the world of phobias. I feel like I've learned so much about the different types, the impact they have, and most importantly, the fact that effective treatments actually exist. It's given me a lot to think about.
It's a lot to process.
Yeah. One of the things that's really stuck with me is this idea of patient filtering that we were talking about.
Yeah.
It's heartbreaking to think that so many people are suffering in silence.
It is.
Dismissing their fears as not serious enough to seek help.
Right, they're minimizing their own suffering.
Right, and it just really highlights the importance of, raising awareness and normalizing conversations about mental health.
Absolutely.
If we can encourage people to talk about their fears and anxieties without shame, maybe they'll be more likely to reach out for help when they need it.
I completely agree. We need to create a culture where seeking help for mental health conditions is seen as a sign of strength, not weakness.
Right.
It takes a lot of courage to confront your fears and ask for support.
And speaking of confronting fears, I'm curious to hear your thoughts on something we touched upon earlier. This idea that if we can learn to unlearn fear individually, could we create a less fearful society as a whole?
That is a huge question, and it's one that I've been thinking about a lot myself.
Yeah.
And I think it's possible. But it would require a really fundamental shift in how we approach mental health, both individually and collectively.
So what kind of shift are we talking about?
Well, for starters, I think we need to move away from this idea that fear is something to be avoided
Okay.
or suppressed at all costs. Fear is a natural human emotion,
Right.
and it serves a purpose.
Right.
It keeps us safe from danger.
Right.
The problem is when fear becomes so overwhelming that it starts to control our lives.
So it's not about eliminating fear, but learning to manage it in a healthy way.
Exactly. And that starts with understanding what fear is, how it works, how it can manifest in different ways.
Right.
We need to educate ourselves and our children about mental health,
Yeah.
just like we educate ourselves about physical health.
It makes me think about the role of early childhood experiences
Yeah.
in shaping how we respond to fear.
Absolutely.
If we can create supportive and nurturing environments for kids where they feel safe to explore and express their emotions, maybe we can help them develop healthy coping mechanisms.
Right. And early intervention is key when it comes to mental health.
Right.
If we can identify and address anxiety and fear in children,
Yeah.
we might be able to prevent those fears from developing into full-blown phobias later on.
Right. It's about changing the trajectory, not just treating the symptoms.
Exactly.
And it's not just about children either.
Right.
I think adults can learn new ways of coping with fear and anxiety too.
Absolutely. The brain is incredibly adaptable.
Right.
We can learn new skills and strategies for managing our emotions at any age.
Yeah, it's never too late
It's never too late.
to develop healthy habits
Right.
and build resilience.
Exactly.
Well, we've covered a lot of ground in this deep dive.
We have.
And I have to say, I'm leaving with a sense of hope.
That's good.
We've learned that phobias are common,
They are.
they're impactful,
Mhm.
but they're also treatable.
Absolutely.
There's no shame in seeking help for a phobia or any other mental health condition.
Couldn't agree more.
In fact, it's a sign of strength and self-awareness. And with the right support and treatment, people can overcome their fears and live full and meaningful lives.
Well said.
So remember, you're not alone in this journey.
Right.
There are resources available, and there is always hope for healing and growth.